welcome back. In this video, we're going to be taking a closer look at how we as Americans treat and pay for mental health issues and where we compare with the rest of the world. Thanks for joining me today. So, where do we rank in the world? I want you to think about that question. So, starting in the 1950s, here in America, we had a series of mental health issues, policies that were put into place where nobody wanted to pay for mental health anymore. But especially about 1955 is when it really started to hit the fan. 1960, 1962, they got to the point where they just started closing facilities because there was no money left. The federal government didn't want to pay for it. The states certainly didn't have the money to pay for it to run these facilities anymore. The public funding, and private donations that they got, pretty much dried up. So some of these places had 100, 200 patients, and they weren't exactly what you call the best run facilities anyways. These were not your cushy little, retreats, These were some of them were really freaking deplorable, and the care that the patients got was even worse. It was downright shocking, and a lot of politicians and people used that to their advantage, and they pushed that, especially civil libertarians and lawyers. They pushed that to the max, and they got a lot of these places closed down. But they didn't think about or have any idea what they were going to do with these patients once they got them out of there and they got these places closed down. Well, they couldn't go off to the next place because most of the places were at full. They were at max capacity already. Where were they going to go? Well, the civil libertarians and the lawyers really didn't care. Neither did the floundering politicians of the day who were listening and taking orders from up above them, Congress, and from the president. Neither one of them wanted to pay for mental health anymore. It wasn't popular. What was popular was arresting people, putting them in jail, locking them away, throw away the key, never have to see them again. And that stayed pretty much true all the way through until 1984 and Ronald Reagan. Reagan said, "That's it. I'm not paying for this anymore. The American people don't want to pay for this anymore." So the next largest round of closures of state mental hospitals and, in a lot of cases, community-based mental health hospitals were closed. They just had no money at all. Couldn't pay for the staff. They had already been seeing dwindling funds for years. On average, 7.5% decrease every single year since 1965. They saw diminished amounts of funding to keep the hospitals running. So they had to cut back on staff, which then, and they had to cut back on upkeep and maintenance on the places, and food and repairs, to basic, quality of care. So what happened? They became worse and worse and worse until finally they said, "We don't have any money left anymore. Open the door and then let the patients walk out." In some cases, they said, "You know what? We really want to keep you here a little bit longer," so they try to keep them as long as they could. Those who were truly mentally ill and possibly, harmful towards themselves or to the communities they were releasing these people out into, they tried to keep them medicated as long as they could. But when they ran out of money to even keep them medicated or keep them in the hospitals anymore, and they had just a handful of staff, they had to let them all go. That's the facts. Did we do anything differently in between there? God, that was 1984. You would think that somewhere along the line we would have come up with a better idea since then, but we haven't. There are, each and every state may have one or two, state mental hospitals left, and, but we spend far more on other kinds of incarceration of people who are mentally ill. Namely, we spend a ton more on people who are sex offenders. Yes, almost triple the amount of money to to house a sex offender as opposed to somebody who is mentally ill. And I'll get into the cost here a little bit later on in this video. But you need to understand, so they've recently been doing a review of policies, that closed all these mental health hospitals and community, mental health centers. And they found in a lot of cases, the reason why they were closed, besides funding and it not being popular, and nobody wanted to live near them. It's like, well, can you move that place just a little bit farther outside of town? I'm building my little track home in the 1950s, but we had the baby boomers coming in, and we were bulldozing forests to put up houses, get rid of farmland so we could build houses. We didn't want to live next to a mental health hospital. And if Uncle, David or Johnny or Cousin Mark, need to go somewhere, fine. Send them to someplace. Just make sure it's someplace far, far away where we never have to see them again. And I'm not talking about if they were a sex offender. I'm talking about if they're mentally ill. Within a family, and I'm sure you probably know somebody yourself who, in the 1950s, maybe 70s or 80s, if they had a mental health problem, it was just never talked about within the family. And we're still that way to this day. In a lot of cases, we don't talk about mental health when it comes to, even within our own families. And finally we just wait for somebody else to take care of the problem. Oh, he went away. Yeah. We don't care. As long as they're not there in front of us anymore, or walking up and down the street, you screaming at at rocks or grass blades, we don't care. That's who we are. And when I get into the statistics later on, towards the end of this video, you'll understand. So, who really was to blame? Was it the American Psychiatric Association? Was it the lawyers? Was it the civil libertarians? Was it, psychiatrists? Who was it? I mean, besides Congress, that these places were a complete failure. Well, when it comes right down to it, in a lot of cases, when it came to psychiatric, care in America, everyone is to blame. We didn't want to support it as a community. We didn't want our loved ones around us who had problems, and we certainly didn't want to have to pay for it. We just said, you know what, snap out of it, get over it. Oh, I'm sorry, you can't? Well, it's not our problem. Go away. Go. So what does it cost? This is the breakdown of costs of different kinds of incarceration and mental health and overall, okay? So these hospitals closed, a lot of these, people were in, they stayed there. They were not patients if they're members of our family, right? If they're no, Uncle Johnny wasn't a patient. He was just there, visiting, or he was getting help there. But we don't want to say the word patient when it comes to somebody in our family. So we'll just call them others. If someone went to, so after these places closed, and they went to, say, a county lockup, and with mental illness, all right? It costs, on the federal level, $87.61 a day to house somebody with a mental health problem. On a state level, average-wise across the United States, it's $85.71, just a little bit cheaper than the federal level, or $31,286. That's on top of the cost. Both of those are on top of the cost of the incarceration. So if it costs $130 a day to incarcerate a normal inmate, you add another $85 or $87 to the top of that for somebody who is mentally ill. That's medication, guards, and other things, because a lot of mentally ill patients cannot be put in general population. They must segregate them away for their own safety, and in some cases the safety of the normal inmates. What was the cost when we ran for those states who still have mental hospitals? And of the lower 48 states, 37 of them have state mental hospitals still. The average cost is $51.32 a day. The average, that's if they are not on medication and they're able to just be dealt with either therapy or something else. If they're on medication, it's $68.10. Still $21 to $23 cheaper than jail. But see, we're saving ourselves money, right? Because we didn't want to pay for the mental health where they could actually get better. Let's just medicate them and put them in jail. Good job. You should be proud of yourselves. What's the cost if we have them in community mental health treatment, where they have a place to live and they don't necessarily live there? Maybe we get them an apartment or a group home and we treat them that way. Well, it's $28.74 a day. $30. Or would you rather pay $68? Oh, that's right. Congratulations. Good job. We closed the mental health hospitals, and we don't want to treat them in community. So, with that being said, February 15th, 2018, while you were sleeping, and apparently you've been sleeping every day, since then, your orange president announced that he is going to cut 70% of all funding within the Medicaid and Medicare program for mental health. 70%. That's part of his budget. Think I'm lying? Google. Yeah. So, when it comes to mental health quality of care here before our current orange president, what were we spending on within the Medicare and Medicaid program to care for the mental health? Well, it was becoming an ever increasing lower percentage every year. When it comes to spending here in America, where does mental health the cost? Where's our list of importance? Where's mental health? Is it number 2? I think it's number 2, isn't it? No, it's not. Not even close. When it comes to actual federal money and state money that goes to pay for research and treatment, diabetes is number 1. Urogenital is number 2. Endocare, blood diseases, are number 3. Non-communicable diseases is number 4. Neurological is number 5. And a distant 8th is mental health. Yeah. 7 and is tied with, there's 3 different ones that are tied for 7th. A distant 8 is where we are. So, what is this, it doesn't matter to you, right? When it comes to mental health. I mean, you don't know anybody that's mentally ill. How about this? When it comes to loss of productivity here in America, people missing days because of depression, or they have to deal with a loved one who, is having mental health issues. What is the total loss of production per year? Well, it is $71.44 billion every year is lost because mental health issues is affecting either the worker or someone to care for, or a spouse, somewhere along the line. But 71.44 billion with a B. Lost production every year. And in case you're wondering, that's number 2. Number 2 reason why we have a loss of productivity here in America. Now, on to the most depressing part of this video. Where we rank as a country, where states rank on spending, and where we're going from here. Well, I already leaked that little bit about Trump wants to do away with 70% of the money that is going to mental health care through the Medicaid and Medicare program. Let's say here. Well, let's start off with the worst states when it comes to mental health. The worst states are Nevada, Utah, Oregon, Idaho, Indiana, and Mississippi. All Republican controlled. Coincidence? I'm sure it is. Where do they rank in the total of all the states? Well, Nevada is ranked 33rd. Utah is 39th. Well, Oregon is number 11th. Idaho is number 49th. Indiana is number 40. And Mississippi is number 43. That's on total spending. Yeah, well, Oregon's number 11. Well, how much do they spend? So I want you to think about this as well. So between 1960 and 1984, when we had a severe decline in places, and psychiatric care, and I'm talking about everything from just low-level depression all the way to the top to the more severe mental health issues. We closed mental hospitals. We did away with community care clinics and community care hospitals, inpatient. We did away with drug treatment and places where people could deal with they have an underlying mental health issue, which makes them use illicit drugs. We had the Vietnam veterans coming home who were dealing with some messed up issues, and we ignored them at great perils. We did away with the action that we needed to put into place to deal with those who were experimenting with illicit drugs because of the rock and roll hippie movement, whatever you want to call it. Blame it on how you want to classify that. We had a lot of turmoil in this country, and we were slashing the bottom out from underneath basically our safety network. And we said, you know what? Just go away. It didn't matter how much we prayed upon a lucky star, crossed our fingers, it wasn't going to go away. We didn't want to deal with it as society, and we didn't want to deal with it in our homes. We said, look, as long as we pretend it's not there, maybe it'll just fix itself. Well, it's 2018 now, and we still don't want to deal with it. If we allow the president to say things like, he's going to do away with 70% of the mental health budget for Medicare and Medicaid because he doesn't like it, and he gets a group of politicians to back him and say, you know what, we're going to get our way. What does that say about us as a nation? Are we making America great again? I don't care which side of the aisle you sit on, but when it comes to mental health, we have ignored it for so long because we did it one way, it failed. We said, you know what? Instead of trying another way, like all the other countries out there who have been successful, we don't want to follow them, and we don't want to do what they're doing. Let's just not do anything at all. And that's where we are today, here in America. We just decide, let's just put a Band-Aid on it and call it good, and pray that that it all works out. All right, I told you at the end of this video, I'd tell you where the United States is when it comes to mental health care and where we are on spending overall. Take it all, put it all together, and you look at all the other nations of the world. Where is America? Well, sad to say, the United States of America is number 9. When it comes to mental health care and treatment and what we spend on it and research and everything else, we are number 9 in the world. But at the same time, though, you can pat yourself on the back. We are number 1 when it comes to nations and when it comes to spending on healthcare. How can we be number 1 in the world on spending of healthcare and be number 9 otherwise? Well, we put all of our money into everything else before we put it into mental health. Think that's bad? when it comes to drug treatment and alcohol programs, you know, detox and treatment for alcohol, abuse, we are number 23 when it comes to dealing with that issue. But that's for a whole nother video, a whole nother day, a whole nother discussion. I've already kept you here long enough, you know, talking about this. But I want you to just think about it. Leave a comment below. Do you think that there's ever going to be a day here in America where we actually take a serious hard look at mental health and decide to do the right thing? Thanks for stopping by today. You stay safe out there.